Good morning, guys. Welcome to episode 58 of Tiny ADHD Superpower. Today's topic is on ADHD and inattentiveness part 2. So, tips for managing inattentiveness in ADHD adulthood. An adult with inattentive ADHD may find it challenging to perform some of the everyday tasks, such as staying organized, keeping appointments, paying the bills on time, maintain a relationship with friends and family. However, several strategies can help a person with ADHD to maintain the focus and regain control over their daily life. Some helpful techniques include getting organized. This can compensate for any sympathetic for forgetfulness. Make to-do lists, use calendars and planners, try to avoid procrastination. Also, it can help to designate specific areas for important items to reduce the risk of losing them. It may help to avoid clutter by paying bills online and opting for paperless transactions, if you remember them. When a collection of paperwork is unavailable, it can help set up and maintain a clearly labeled or color-coded filing system. And I do that a lot. I'm very organized, so I don't have a problem with that. Managing time, I do. Time perception can be difficult for people with ADHD. Set specific times to do certain tasks. It can help to keep clocks handy, set up alarms and reminders. Again, do not use snooze. Set different alarms every 5 minutes so you know that you're rushing for time and you will be there on time. Alarms can also help a person to plan for breaks during longer activities. Yeah, I need that. I tend to work for 2-3 hours straight without standing up, and I know that I need to. Ahead of appointments, plan to arrive early instead of on time. Staying focused. It can help to start each workday by setting aside 5 to 10 minutes in which to organize tasks and workloads. Try to work in a space with a few distractions as possible and little commotion as possible. People with ADHD tend to have multiple ideas at once and lose track of them. So like I said before, it really helps, especially in meetings, to write down ideas as they occur. Come up with different categories first in your book, and then subcategories, and then, put a sticky type on them, make it colorful, make it your own book. And then with each research that you have done, you come across, even with one sentence, write it in that category, and you begin to integrate. Once that book is complete, you will realize how much you have learned. So takeaways. Difficulty to concentrate and pay attention for details, the hallmarks of inattentive ADHD. Children with the condition and the inattentive specifier often find it challenging to handle daily social interactions, such as joining in a place, initiating friendships and relationships, and resolving disputes. They sometimes experience social rejection as a result. This relatively small representation may be because children with inattentive ADHD are often less disruptive than kids with combined ADHD, and their behaviors may be easier to overlook. The goal to treating inattentive ADHD are to reduce symptoms, to address challenges and affect behavior, to improve functional performance, and make it your superpower. So around 1/3 of the children with ADHD will continue to have the defining symptom into the adulthood. However, receiving appropriate treatment, both medication and therapy, will reduce and manage symptoms so that people with ADHD can lead to productive, fulfilling lives. Thank you, guys. See you tomorrow.